Before we move on to discuss vascular diseases, let's quickly consider cardiac tumors. Unlike most other tissues in the body, the heart is only very rarely subjected to neoplasms. The most common type is an atrial myxoma, which is a benign growth that can obstruct the left atrium. If these obstruct the right atrium, this can lead to Kussmaul's sign, where the JVP, or jugular venous pressure, increases with inspiration due to poor filling. Another possible growth is a rhabdomyoma, a benign tumor of cardiac myocytes associated with tuberous sclerosis in children. Additionally, there can be metastases to the heart, and these are actually more common than primary heart tumors. Now let's move on to diseases affecting blood vessels. We'll start with varicose veins. These are superficial vessels that are enlarged and tortuous, usually due to chronically elevated venous pressure. These are a common finding in elderly patients or in patients with prior surgeries. Varicose veins carry with them a risk of poor wound healing and varicose ulcers. Although there is a very rare risk of thromboembolism, remember that this condition is much more common with deep veins. On the other hand, varicose veins are superficial. Next, let's discuss Raynaud's disease. This is a benign vascular condition that affects small vessels. It's characterized by the sudden decrease in blood flow due to arteriolar vasospasm, often in the response to cold temperature or, interestingly enough, emotional stress. As shown in these pictures, the fingers are most often involved. One important thing to remember is that when this happens in the context of any connective tissue disease or other inflammatory condition, it's known as Raynaud's phenomenon, not Raynaud's disease. Let's move on now to vasculitis, which is inflammation of blood vessels. This can be a confusing topic for students because there are a lot of details to memorize, but these tend to be very high yield on the exam, so it's important to pay attention to the specifics. Although we won't cover everything here, let's go through and highlight some important concepts. First of all, it's helpful to think about vasculitis in terms of the size of the vessel that's affected: large, medium, or small. Let's start with large vessel vasculitis. The first large vessel vasculitis to consider is temporal arteritis, also known as giant cell arteritis. In this disease, which typically affects elderly females, large arteries in general, and specifically branches of the carotid artery, are affected by focal granulomatous inflammation. Classically, this happens in the temporal artery, hence the name, leading to unilateral headache and jaw claudication, such as when chewing food. However, the most serious consequence of this condition is when this inflammation happens in the ophthalmic artery. This can produce irreversible blindness. For this reason, when a patient presents with symptoms of temporal arteritis, it is very important to confirm the diagnosis with a temporal artery biopsy and then begin treatment immediately with high-dose steroids. This image shows a classical picture of temporal arteritis, with a narrowing of the vessel lumen and granulomatous and mononuclear inflammation inside the arterial media. The next large vessel vasculitis is Takayasu's arteritis. This disease typically affects Asian females younger than 40, and it is also granulomatous inflammation. But in this case, it's the aortic arch and the great vessels that are affected. Because these vessels supply the upper extremities, this condition is sometimes known as pulseless disease due to the weak lower extremity pulses. Other symptoms include fever, night sweats, and others listed here. This angiogram shows an example of Takayasu arteritis, with multiple areas of stenosis in the great vessels. Now let's move on to vasculitis that affects medium-sized vessels. There are three important conditions to keep in mind, and as we talk about them, let's make sure to highlight how to distinguish them from one another. First, let's start with polyarteritis nodosa, or PAN. This is a condition that typically affects young adults. It manifests with a variety of symptoms, including fever, weight loss, abdominal pain, hypertension, and cutaneous eruptions. Interestingly, there is also coexistent hepatitis B seropositivity in 30% of these patients. Pathologically, PAN is characterized by immune complex mediated transmural inflammation. Often, there is also fibrinoid necrosis, and it usually affects renal and visceral vessels. The treatment for PAN includes corticosteroids and cyclophosphamide. The next disease to consider is Kawasaki disease, which classically affects children younger than the age of 4, and more commonly affects Asian children. Symptoms include fever, conjunctivitis, as well as changes in the lips and oral mucosa known as strawberry tongue, shown here. There is also erythema and desquamation of the hands and feet. The risk with this condition is that it can lead to coronary artery aneurysms, so it's typically treated with IV immunoglobulin, also known as IVIG, and aspirin. The final medium vessel vasculitis is Buerger's disease, also known as thromboangiitis obliterans. The easy way to remember this disease is that it's a disease of smokers. It's also more common in males younger than 40 years old. Common symptoms include claudication of digits that may result in gangrene and autoamputation, and possibly Raynaud's phenomenon, which we've already discussed. The only real treatment for this disease is cessation of smoking. The image shown here is an example of Buerger's disease, showing complete occlusion of the right femoral artery and stenosis of the left femoral artery. Finally, let's discuss the vasculitides that affect small vessels. There are 4 important diseases to consider here. 3 of them are positive for some type of anti-neutrophil cytoplasmic antibody, or ANCA for short. Wegener's granulomatosis is the odd one out in that it's positive for C-ANCA and not P-ANCA. This is a condition with a large number of symptoms depending on the vessels that are involved. This may include upper respiratory symptoms, lower respiratory symptoms, and/or renal symptoms. And the classic triad of pathological findings is necrotizing vasculitis, necrotizing granulomas, and necrotizing glomerulonephritis. Wegener's is usually treated with cyclophosphamide and steroids. Although this is a complex condition with many details, the most high-yield parts are 1. The fact that it's positive for C-ANCA, and 2. The presence of granulomas, especially in the lung and upper airways, such as this shown in the CT image here. The other 2 conditions are both positive for P-ANCA. The first is microscopic polyangiitis, which is characterized by a lack of granulomas. The second is Churg-Strauss syndrome, which is characterized by asthma, peripheral neuropathy, and granulomas with eosinophilia. Be careful in distinguishing these last 2, because they are both pauci-immune conditions that are also associated with palpable purpura. The final vasculitis to talk about is Henoch-Schönlein purpura, or HSP for short. HSP is an immune complex disease associated with IgA nephropathy, and it is common in childhood, especially after an upper respiratory infection. This classic triad of HSP is palpable purpura, shown here, arthralgia, and GI symptoms. One last topic to mention as we finish talking about vasculitis is Sturge-Weber disease. This is not really vasculitis because it is not inflammation of the vessels. Instead, it's a congenital vascular disease that affects small blood vessels, leading to port wine stains on the face, along with ipsilateral angiomatosis of the meninges and resulting arteriovenous malformations, or AVM. Please note that AVMs are covered in more detail in the neurology section. The image here shows a classic port wine stain on the face. Let's finish our discussion of cardiovascular pathology by going through vascular tumors. This table is a high-yield list of diseases that might appear on the exam. As with the vasculitides, there can be a lot of detail to this, so we'll focus only on the most salient points as we move through. First, strawberry hemangiomas are benign and associated with infancy. They typically regress spontaneously over time. Cherry hemangiomas are also benign, but these are usually associated with old age, and they do not regress. Also, they tend to be much smaller. Cystic hygromas are cavernous lymph vessel tumors found especially in the neck, and they are associated with Turner syndrome. Bacillary angiomatosis refers to skin papules found in AIDS patients. They are caused by infection with the bacteria Bartonella henselae and are commonly confused with Kaposi sarcoma, which we'll discuss shortly. Angiosarcoma and lymphangiosarcoma are both malignant cancers, the first of blood vessels in the liver and the second of lymph vessels in the setting of persistent lymphedema. One common setting for this is after a radical mastectomy. Finally, Kaposi sarcoma is an endothelial malignancy that is caused by human herpes virus 8 and is strongly associated with HIV infections. As previously mentioned, it is commonly mistaken for bacillary angiomatosis. Great job! That finishes up the cardiovascular pathology section.